And we have Dr. Altaf Ahmed, who will be speaking from a different perspective, which is hospital infection control in Pakistan, past, present, and future. He is the president of Infectious Disease Society of Pakistan. Dr. Altaf, please.
Thank you, Zaki. आज सुबह मेरे पास मैसेज आया कि 23 मार्च 1940 को भी आया था और 23 मार्च आज भी है. उस वक्त हमें एक मुल्क की ज़रूरत थी, कौम को आज मुल्क को कौम की ज़रूरत है. Well, talking about infection control, past, present and future, Miraj, thank you very much for making my life easier. Right, talking about the data and evidence, what evidence I have to talk about infection control problems in Pakistan. If you look at this Lancet study, you can see clearly that many thousands of people are dying because of infectious diseases acquired in the hospitals, and many more in the developed countries. So how many are getting infection in Pakistan? If you compare the mortality in UK, it is much more than road traffic accident and suicide. So it's not a minor problem. I've been talking on infection control since last many years. But again, once more, why not? The little has been done for infection control in our hospitals. So what are these common hospital-acquired infections? These are urinary tract infections, lower respiratory tract, wound infection, skin infection, and infection related to blood and some other infections as well. And everybody has got this knowledge. It's not something that people don't know about it, especially those who are working in a hospital. So why not once again to talk about these infections? These infections, patient doesn't come with these infections in the hospital. They acquire it within the hospital. So the hospital are responsible somehow for providing these infections. Right. So if you look at a little bit in the past, it all started a long time ago. And there were people like Ignace Semmelweis who first discovered that yes, this is something related, the patients are dying, not because of for the disease they have, but the way they are acquiring it, because of healthcare workers, that includes doctors and nurses and everyone who works in the hospital, by their negligence. And he, when started implementing hand washing, the mortality was reduced by 90%. Similarly, Joseph Lister, and this was hundreds of years ago, a Scottish surgeon who implemented carbonic acid spray and showed that these infections can be reduced by taking certain steps. And that we are not really following it. The first infection control nurse was appointed in England in 1959, and the Nursing Association was formed in 1970. And before 1970, there were only 6% of hospitals in UK which had infection control nurse. And by 1977, in 7 years, over 80% of hospitals in UK got infection control nurses. But in Pakistan, situation is very bleak. Today, only 10 hospitals have got infection control nurses, and as department, before 1970, none had. Before 1990, there was no infection control nurse, and 1990 till date, only 10. So the progress is very slow, and it's not like we should have in our system. Of course, priorities are different in the developed world and the developing world. The priorities in developed world is care of the elderly people, rehabilitation and palliative care. But unfortunately, what they are implementing in their system, much of these experiences are not applicable in our part of the world, which we have to understand. The facts are there. It's poverty related. You heard Sania Nishtar, lack of trained manpower, health budget, no surveillance system, lack of research initiatives. All these are, we are still being surrounded with all these issues. Policy making is a big task, lack of awareness and commitment, surveillance data and isolation facilities, as Miraj has already pointed out, about waste disposal and antibiotic misuse. So a lot of issues. Still in many hospitals in Pakistan, the sharing of incubators, IV insertion line not taken care of, inadequate disinfection of equipment, and a long list of problems we are faced with. There is still no hope. And it's simple. It's simple to understand that a patient in ICU or intensive care unit or anywhere in the ward will be infected with certain germs, which are shown here by brown spots. And these can be transferred by the healthcare worker whenever he comes near to the patient doing something, taking blood pressure and pulse, and it multiplies with the duration of time when there is moisture and heat, and it keeps on climbing, and the rate of infection increases, the microbes increases in number, and if you don't wash hands properly, you can transfer this from one patient to another. This is such a simple thing to understand, and yet being totally neglected. And there are some other issues like safe waste disposal somewhere in Karachi, and selling of syringes and needles, which is still going on, and you can really have a price on it. This price, which was known to me, was about 5-6 years ago, that 11 rupees per kilogram of hospital waste of syringes and everything, and which must be going on at a higher rate nowadays. So sweepers or healthcare workers in the hospital are responsible for that, and we know the amount of hepatitis we have, and that tiny amount of hepatitis blood, which is hardly visible from your naked eye, can be responsible for providing infection to a person. So this many percentage of the whole population of Pakistan is involved, 5 to 10% in hepatitis B, 7 to 12% hepatitis C, and so on. So this is a huge problems which we are facing. According to one study, there was 10% of commercial blood donors and 5% of family donors are infected with hepatitis B. And even healthcare workers are getting these hepatitis, especially the training nurses and trainee doctors, and in those hospitals who have still not yet implemented hepatitis B vaccination for their healthcare staff before they join the institute. I don't see any nursing guidelines which say that trainee nurses should get hepatitis B vaccination before they start their first year. And same is the case of hepatitis C. And there is a lot of patient and healthcare workers who have been involved with hepatitis C these days. We are yet another big problem, and the emerging problem of bacteria, which is known as NDM1, which has been reported from Pakistan, India, and UK, and these isolates have been detected in various parts of the country, most of the antibiotics are resistant to these bugs, and it's very difficult to treat these organisms, and this is all because of the misuse of antibiotics. TB is another big problem, and we are some of the very high burden of TB country in the world, which is a big problem. And besides, you can see a trend of rising multi-drug resistant TB in the country, and you know there is a huge difference between a simple tuberculosis and an MDR tuberculosis, including now we have been reporting XDR TB, which is a big issue, and none of the antibiotic works on these patients. So everything is there, and our hospitals has really been involved in treating these patients without infection control aspects. Another issue is the antibiotic resistance. Many of the doctors and my own colleagues said that you talk too much about infection control. We have got antibiotics. Why are you so worried about? If the patient gets an infection, we'll treat him with an antibiotic. So I said, no, the increasing antibiotic resistance, and nowadays the West or the pharmaceutical companies, they are more towards antidepressant medicine, as we have seen in the first lecture, and more towards neoplastic oncological medicine rather than antibiotics. So antibiotics manufacturing is going down, and it is decreasing day by day, and pharmaceutical are not more interested. That's why you don't see many new antibiotics in the last 10 years being in the market. So this is a big problem, and the amount of antibiotic use used in Karachi and in the country for simple diseases like typhoid, which is now more than 60% of typhoid is resistant to quinolones. And you see a large number of antibiotics being used in Karachi in Pakistan. So what is the cost of hospital-acquired infection? If that is a big problem, there is a direct cost to the health services because of the extension of the stay, extra resources, extra treatment, equipment, and direct cost to the family and the patient himself. Pain and scarring, extended stay, working days lost, income lost, all those agony because of hospital-acquired infections. So that the dark scenario is this: new and resistant mechanism will emerge and disseminate. Rising resistance rate, most pathogen, Staph aureus getting more and more problematic in our society, new pathogens, limited resources, and lack of awareness. So, if a nurse says that I have changed 24 beds, decreased 25, dressed 25 wounds, emptied 20 bedpans, washed and dressed 16 patients, given 25 injections, bandaged 3 sores, removed 48 stitches, and helped 10 people in a loo, you are the next without hand washing. You can imagine the scenario. And this is what's happening. And now, something very rare in Karachi. And I have seen this myself in some of the very famous hospitals in this city, the buffalo pox virus infection. And this is amazing, and nobody knows. We have been to the health ministry for this to dig out where this is coming from. But this is mostly among the burns patient, and we have published the data. It is confirmed that this is a buffalo pox virus in some of the burns patient in Karachi. And what is happening, nobody knows about it. Again, use of mobile phone. Yes, people are very much famous. This is a mobile phone of a healthcare worker in a hospital, and you can see the amount of bugs involved in mobile phone. And still, this is being used in the ICU, in the marrow transplant units. I have seen people using mobile phones and touching the patients. And what can be done? Simple steps, simple, very, very simple. Doesn't need a rocket science for that to understand. Simple universal precaution is just the promotion and implementation of these steps, which is very, very necessary. There's nothing big to do. There are future of new development of new kind of masks available, which are coming rapidly in the market. There are washable keyboards. As the keyboards in the hospital get infected, and the healthcare worker use it and transfer it to the patients. There are portable HEPA filters coming on. There are all kinds of portable things. Somebody was in civil hospital telling me that how can we wash hands when we don't have water? Well, you can make simple steps like this and utilize water for that. There is no other option like hand washing. So what to do? Well, let's do the easiest thing. Break the chain of infection by all those precautions I just told you, simple precautions, and you get rid of the means of transmission. Break the chain of infection. Guidelines. I've been told by several hospitals, make a guideline of infection control. I have made it so many times, but is that implementable? Not most of the time, it's not. It's just piece of paper or a soft copy in your computer, and that's it. Implementation never works unless you have a commitment. So single most important cause, again, is, yes, I agree with Miraj, is the reluctance to wash hands is still the single most important cause, and that is the growing concern about poor hospital hygiene in most of the hospitals. So conclusion, infection control legislation should be implemented by the Ministry of Health, implementation of safe waste disposal. Infection control nursing training should be approved by Pakistan Nursing Council. There should be a mechanism of surveillance data, lower cost of auto-disable syringes. With so much hepatitis in this country, we need it. We must do something to prohibit sale of antibiotics without prescription and control on sale of low-quality medicine. But that wish list will take some time. What we can do right now is the judicial use of scarce resources, highly motivated team, and support of the administration. None of the department can work without the support of the administration. And of course, education and awareness is the cornerstone, and we definitely need a teamwork. Without teamwork, nothing happens. Thank you.